Welcome back. All right, we're going to talk about something all men should have open conversations with their doctor about. Listen to me, guys. Prostate cancer. It's the most common type of cancer in men, with over 40,000 new cases diagnosed every year. So today we're talking about it with Dr. Melkus with Baptist MD Anderson Cancer Center. He's with us here, and we're going to break down all of it from the A to Z of the whole thing, the screening process, all the way from basically. Let's start with the prostate and what its function is.
Yeah, good question. The prostate is a male organ that provides the majority of the fluid for reproduction, and it is a gift that keeps on giving in that it grows your whole life, but it also can be prone to getting prostate cancer.
So who, I guess, like you said, it grows your whole life, all of us have it, but who are the people most likely to have prostate cancer?
Basically, almost every man as they get older are at increased risk for getting prostate cancer, to the point where if you live long enough, you probably actually will get it. The big question is it a prostate cancer that matters? And that's what really segues into screening and appropriate screening.
So there's some that it's okay to have, and others that it's like we got to take care of that.
Yeah, I might be going out on a limb here, but I would argue that a lot of prostate cancer, even the majority of it, quote unquote, doesn't matter. Not meaning that we shouldn't identify it and track it and follow it, but yeah, there's a role for active surveillance now, whereas we used to think of those as more aggressive, but we really are trying to focus on those prostate cancers that matter, the ones that are deadly.
All right. Well, for anyone out there who may be having symptoms or warning signs, or what should they be looking for?
Interestingly, prostate cancer for the most part is asymptomatic unless it's a very advanced stage. So regular screening is very valuable, and this is most commonly achieved with your primary care doctor. The most common screening associated with prostate cancer evaluation is the PSA test.
Yeah, I think that's one of the things people always want. I'm 44, so
yes.
and you hear when you should get screened is it if you have a history of it, it's earlier, or what are the kind of guidelines for when you should get screened?
That's a really good question. It's been very controversial over the past decade. Before PSA came about, the majority of people presented with lower back pain, for example, because the prostate cancer is already metastatic, so it has already escaped the prostate. PSA screening came about essentially in the 1990s. We diagnosed a lot of prostate cancer, and a lot of that prostate cancer actually was probably not going to affect the patient's quality and quantity of life. So the U.S. government, the U.S. task force, actually said, hey, we're actually overtreating prostate cancer. Therefore, maybe we shouldn't even do PSA screening at all. And that was actually the recommendation of the U.S. task force in 2012. Obviously, a lot of urologists disagreed with that. A lot of primary care doctors did as well. Further analysis of the data has come out, and the U.S. task force actually has revised their recommendations just this year to state that PSA screening is reasonable for people age 55 to 69, counseling them on the proper, the benefits and risks of the screening. For those age 40 to 55, it can be considered as well if you have high risk factors such as a first-degree relative, a brother or father with prostate cancer, or several sisters or a mother with breast cancer, and also African Americans that are much higher risk of having a prostate cancer that matters, or high-risk prostate cancer.
And it's a pretty simple screening. I mean, all you can do is request it from your primary care, and they can either send you to a urologist, or how does it work?
Most of it's actually done with your primary care doctor only. It's just a blood test, and they may or may not perform a digital rectal exam to evaluate the prostate at that time. But it's a screening that can be done annually. Some people actually argue that you can do it every other year.
Well, it's just important. We hear it with every type of cancer. The sooner you catch it, the much better your odds are of survival.
Absolutely.
All right. Well, we appreciate your time here. The BPH, real quick, how can people manage their BPH? Is there a way, or is it just?
As I mentioned, the prostate grows your whole life. It's the gift that keeps on giving. And enlarged prostate affects people to different degrees. Talk to your primary care doctor. Sometimes we can just offer some modifications, drinking less fluid in the evening time to prevent waking up at night. Yeah. There are medications thereafter, and surgery if we need to.
But the most important thing, guys, like we talked about it, talk to your doctor. Be honest about it. This is something we got to handle. Appreciate your time, sir.
Thank you, sir.
We want to thank Baptist MD Anderson Cancer Center for bringing all this important information and being here and sharing this with you. You can find more information on their website, baptistmdanderson.com, or give them a call at the number you see on your screen, which is 844-632-2278.